The first step to getting an FUE hair transplant is your consultation. This gives you the chance to first meet with the surgeon, discuss your hair loss, and go through your medical history. They will then analyze your hair and assess your suitability for a hair transplant. Next, we'll do before and after shots to visually compare the results after the procedure. This helps to provide the patient and the surgeon with visual records while also tracking the progress of the procedure and evaluating its success. Then, we will collect a blood sample from the patient, which will be used later for plasma extraction. The back of the patient's head is shaved and prepared for the surgery. The area where hair will be harvested is thoroughly disinfected. Anesthetics are injected into the back of the head to ensure the patient feels no pain during the procedure. The hair graft extraction begins. During this step, the surgeon uses a specialized tool to extract donor grafts from the patient's donor area. In the FUE procedure, grafts are always extracted one by one. This type of extraction does not leave an elongated scar on the donor area. Implantation begins. Once a sufficient amount of grafts is extracted, our nurses load individual grafts into the implanter pens, one at a time, and pass them to the surgeon. The surgeon begins implanting them using the implanter pen DHI method. This method of implantation allows us to implant grafts between existing hair and produces a very high density of implantation. The next day, you will have post-operation care and a checkup. Our nurse will remove the bandage at your donor site. Dry wounds will be easier to remove after spritzing with water. After that, the nurse and the clinic manager will explain how you wash and dry your hair. Only use the recommended shampoo on the transplanted hair, spray and let it sit for a few minutes, and then rinse it out without touching it. For 2 weeks, you cannot use hot water, only lukewarm water is allowed. You can use ordinary shampoo on the remaining portion of your hair. Just pat dry your hair and be gentle on the transplanted area. Use only cold air to dry your hair. We shall next employ LED light therapy for 10 minutes. This helps to reduce hair loss, promote hair thickness, and soothe your scalp. Afterward, the nurse will disinfect and apply antibiotics to the donor site to prevent infections. Our doctor will check your scalp and hair progress for optimal recovery.
The experience was really good from start to finish. All the communication was pretty clear and transparent, and I knew exactly what I was getting myself into. In terms of the procedure on the day, it just went really smooth. I don't even feel like I went through a surgery, barely any pain. The aftercare has been great, so everyone's been really helpful. I just can't wait now for 12 months to fly by and start looking fresh again. If you're scared of pain, that's not to worry about. You feel it for 5 minutes when they're doing the anesthesia, but after that, you don't even feel it, you don't even know. But anyway, the communication and the service has been awesome, so can't recommend enough.